everyone. My name is Shannon Craddock, and I'm the Programs and Accreditations Manager at Perry Johnson Registrars. Welcome to today's webinar, ISO 1345-2016 transition. Are you ready for this? Today's webinar is being recorded, and for that reason, all participants have been muted to ensure sound quality. A copy of the recording, along with a copy of the slides, will be available for download from our website, www.pjr.com. Also, from our website, you'll be able to access other previously recorded webinars and get information on future webinars on a great variety of topics. Participants won't be able to ask questions. I encourage you to type your questions into the question feature in the webinar format. And I'll attempt to answer as many of those as possible after today's prepared content. So today we're going to talk about the transition process, what's involved in the transition audit. We're going to go over changed, new, and deleted requirements in 1345-2016 from 1345-2003, or the European version, which is at 2012, and then have time for questions and answers. So ANAB, the accreditation body in the United States, has published a heads-up document, number 340, explaining the transition process for certification bodies and clients of certification bodies. So it's published on the 1st, the revised 1345 was published on the 1st of March 2016, and IAF Resolution 2015 number 13 mandates a 3-year transition period from the date of publication. So we're looking at the 28th of February 2019 for ISO 1345-2003 being obsolete. PJR is already approved by ANAB to conduct audits to 1345-2016, and we're issuing certificates to organizations who have successfully transitioned. Ideally, a client will transition on their recertification audit. So if your recertification audit falls in 2018, we'd ask that you transition then, as we're not going to be adding any additional time if you make the decision to transfer on recertification. If you aren't ready when your recertification audit occurs and want to wait and transition on a surveillance audit, then we will be adding a half day of on-site time to your normal surveillance audit time to conduct an audit of all the additional requirements. In order to ensure that all clients have time to transition, answer any nonconformities that result from their transition audit, for your lead auditor to review your corrective action responses, and for PJR's executive committee to make the certification decision and for the certificate to be answered, we are saying that 1st of December 2018 is the last day that you should be having a transition audit. This will allow approximately 90 days for all the work to be done prior to the obsolescence date of earlier versions of 1345. So let's get into some of the new, changed, or deleted requirements. Starting with section 0.1 general, we're not even in the normative requirements yet. But here there's a change in that there's more detail regarding the types of organizations that are covered by 1345 and the various life cycle stages covered in the development of medical devices. So the life cycle stages covered by the standard include organizations not only involved in design, development, and production or manufacture, but also storage and distribution, installation and servicing of medical devices, the final decommissioning and disposal of medical devices, and the design, development, and provision of associated activities. The types of organizations applicable can be suppliers or external parties providing product, raw materials, components, subassemblies, medical devices, sterilization services, calibration services, distributions, and maintenance services to such organizations. (1345) we're going to see when we get into the normative requirements. Requires organizations to identify their role under applicable regulatory requirements. Then identify the regulatory requirements that apply to its activities under these roles, and incorporate the applicable regulatory requirements within their quality management system. Section 0.2, clarification of concepts. You'll see the term as appropriate used throughout the standard. For the purposes of 1345, as appropriate is deemed to be appropriate unless an organization can justify otherwise. A requirement is always considered appropriate if it's necessary to comply with applicable regulatory requirements or to help an organization manage risks. Now, specifically, the word risk pertains to safety or performance requirements of the medical device or meeting applicable regulatory requirements. More in section 0.2, clarification of concepts. Use of the term documented is understood to not only be documented or defined, but also implemented and maintained within the organization. So it's not enough just to write down the requirements and write down how you're going to do something. The expectation is once it's documented, it should be fully implemented and maintained. And as always, product is understood to mean service. Within section 0.3, process approach, there are added requirements that really drive the process approach to quality management. Granted, the process approach to quality management isn't new. It's something that we've been flowing down since the 2000 version of the standard. It involves understanding and meeting requirements, considering processes in terms of added value, measuring and obtaining results of process performance and effectiveness, and then based on those results, making improvements as needed to your processes. In section 1, scope, this section again reiterates the expanded applicability of the standard in terms of the life cycle stages that are applicable, and the inclusions of suppliers and external parties. So people providing components, subassemblies, organizations doing decommissioning of medical devices, refurbishment, repair, etc. Really important concept here, the second bullet point. Outsourced processes are the responsibility of the organization and are to be accounted for in the organization's QMS by monitoring, maintaining, and controlling the processes. Just because you aren't physically doing it doesn't mean you're not responsible for it. You've made the business decision to outsource it, you still have to control it. Requirements in section 6 and 8, as well as those in section 7, can now be justified as non-applicable. You'll note that the new version of 1345 does not follow the Annex SL format that's being followed by most of the new versions of standards, and there's still 8 sections. Very similar to 1345, 2003. In section 3, there's a lot of new terms and definitions, and I encourage you to spend some time reviewing those. We could do an entire 1-hour webinar on just the new and changed terminology. I'm just going to review some of the most important terms today. 3.2 is the authorized representative. And this is the natural or legal person within a country or jurisdiction who has received a written mandate from the manufacturer to act on his or her behalf for a specified task with regard to the latter's obligations under that country or jurisdiction's legislation. .4 complaint. And this is being highlighted today because it's different from the 9001-2015 definition of a complaint. It's a written, electronic, or oral communication that alleges deficiencies related to the identity, quality, durability, reliability, usability, safety, or performance of a medical device that has been released from the organization's control or related to a service that affects the performance of such medical devices. So here a very specific definition, very specific to medical devices. Okay, so we talked about on a prior slide, authorized representative. Another role that can be assumed is that of a distributor. And that's the natural or legal person in the supply chain who on his own behalf furthers the availability of the medical device to the end user. There certainly may be more than one in the supply chain. And people involved in activities such as storage, transport, warehousing on behalf of the manufacturer, importer, or distributor are not distributors under this definition. An importer, in contrast to a distributor, is the natural or legal person in the supply chain who is the first in a supply chain to make a medical device manufactured in another country or jurisdiction available in the country or jurisdiction where it is to be marketed. And finally, definition 3.10, manufacturer is the natural or legal person with responsibility for design and or manufacture of a medical device with the intention of making the medical device available for use under his name, whether or not such a medical device is designed and or manufactured by that person himself or on his behalf by another person. I encourage you to read through the manufacturer definition within 1345-2016. There are many subpoints and notes that are important. You'll note that earlier versions of 1345 used italicized font to call out medical device specific requirements. This is no longer used in 1345-2016. All the font is the same. Okay, moving into the normative requirements, 4.1 general requirements. The organization needs to document the role or roles undertaken under the applicable regulatory requirements. Are they a manufacturer, an authorized representative, an importer, or a distributor? And they may take on more than one of these roles for a single or multiple medical devices. .412A, the organization shall determine the processes needed for the quality management system and the application of these processes throughout the organization, taking into account the roles undertaken by the organization. So very similar to 9001 or 1345-2003, determine the processes needed. And then in 412B, apply a risk-based approach to control these processes needed for the QMS. .414A through C, changes to processes shall be evaluated for their impact on the QMS, evaluated for their impact on the medical device, and controlled in accordance with 1345 and regulatory requirements. .415 talks to this concept of outsourcing. So when an organization makes the business decision to outsource a process, it needs to monitor and control the process. The organization itself is responsible for conforming to 1345 and any applicable customer and regulatory requirements. And the controls that are applied to the supplier of this outsourced process shall be proportionate to the risk involved and the ability of the external party to meet requirements. They make the very specific statement that the controls shall be included in written quality agreements. So they need to be flowed down in some type of contractual document. Certainly if the supplier of the outsourced service or product is 1345 certified, there'll be less risk and less control than if it's provided by an entity that is not certified. (416) A specific requirement for documenting procedures for validating computer software used in the QMS. So you need a documented procedure for software validation. All software needs to be validated prior to use and in response to changes in the software or its application. The approach used to validate the software or revalidate the software shall be proportionate to the risk associated with the use of the software, and you have to maintain records of these software validation or revalidation activities. (423) For each medical device or device family, the organization needs to establish and maintain a file containing or referencing documents required by 1345 or applicable regulatory requirements. The file contents are as follows: a general description of the device, its intended use or purpose, labeling and instructions for use, specs related to the product, specs or procedures for manufacturing, package, storage, handling, and distribution, procedures for measuring and monitoring, requirements for installation and servicing as appropriate. (424) Certainly there's always been a requirement for a procedure for control of documents. This procedure now needs to address preventing deterioration or loss of documents. So what controls or safeguards are you going to put in place to prevent this from happening? (425) Control of records. The organization is required to define and implement methods for protecting confidential health information contained in records in accordance with regulatory requirements. In the United States, this might be HIPAA, for example. (561) Requirement here now to document procedures for management review. Top management must review the QMS at documented planned intervals. New inputs to management review include feedback, and the use of the word here is very generic, all types of feedback. Previously this was just customer feedback, complaint handling, and remember earlier we discussed the very specific definition of a complaint, and reporting to regulatory authorities. Now, it may happen at a particular management review that there haven't been any complaints or there hasn't been a need to report to regulatory authorities. However, you still must acknowledge that there were no instances, so we know that you're covering these input requirements. (6.2) Human resources. The organization must document a process for establishing competence, providing needed training, and ensuring the awareness of personnel. So again, we're looking for something documented here, a process, a procedure, a flow chart, a work instruction, use of a defined computer program or record-keeping system, but there needs to be some structure to this element of your quality management system. (6.3) Infrastructure. The organization must document the requirements for the infrastructure needed to prevent product mix-up and ensure orderly handling of product. So documenting the requirements, this could be a procedure, a work instruction, a floor plan map. Something needs to be documented, however. Infrastructure was clarified to include information systems, and maintenance was clarified to be applicable to equipment used in production, controlling the work environment, and monitoring measurement. (641) The organization shall document the requirements for the work environment needed to achieve conformity to product requirements. So for certain sterility requirements, temperature, humidity need to be maintained, need to be aware of electrostatic discharge. These requirements shall be documented. 642, for medical devices that are sterile, the organization has to document requirements for control of contamination with microorganisms or particulate matter and maintain the required cleanliness throughout assembly and packaging. Okay, moving to section 7. (7.1b), planning of product realization. The organization needs to provide resources specific to the product, including infrastructure and work environment. Basically giving the people who are doing the work the tools they need to succeed. The basic equipment, maintained equipment, the working environment, etc. The organization shall determine required handling, storage, distribution, and traceability activities. We're going to see more about traceability in later slides. 721, determination of requirements related to the product. The organization needs to determine any user training needed to ensure the specified performance and safe use of the medical device. Review of requirements related to the product. This review must occur prior to the organization's commitment to supply the product to customer and ensure that applicable regulatory requirements are met and any user training previously identified is or will be made available. 732, moving into design and development planning. As part of the design and development process, the organization has to document the reviews needed at each design and development stage. So when are we going to take a step back and review where we're at, what needs to be done? The methods to ensure traceability of design and development outputs to design and development inputs. How are we going to ensure that the outputs are meeting input requirements? And the resources needed, including competence of personnel. So these three things have to be documented during the process. There is a deletion here, one of the few deletions. The requirement for management of the interfaces was eliminated. Regarding design and development inputs, those relating to product requirements must be determined and records maintained. A new input is usability requirements. Requirements shall be able to be verified or validated. In the design and development review stages that are identified as part of design and development planning, we're now in 735, design review records need to include the identification of the design under review, who was involved to make sure we're meeting the competence requirements, and the date of the review. So 732 and 735 work together. Moving to verification in 736. The organization has to document verification plans. These verification plans need to include the methods that are going to be used, what the acceptance criteria are, including any statistical techniques with a rationale for the sample size. If the intended use of the medical device requires a connection or interface with something else, then the verification needs to include confirmation that the design outputs meet the design inputs when in fact the components are connected or the interface is functional. Records of results and conclusions of verification and any necessary actions that need to be taken have to be maintained. So you need to record the results of your verification activities and any necessary action items that are determined. You'll see that validation in 737 mirrors this. The organization has to document its validation plans. How is validation going to happen and what the acceptance criteria are, if statistical techniques are going to be used, including rationale for sample size. You need to rationalize the choice of product to use for validation and record that. Again, when the intended use of the medical device requires connection or interface with another, the validation needs to be conducted this way. And records of the results and conclusions of validation activities and any necessary resulting actions need to be maintained. New requirement here in 738. This is a brand new requirement, design and development transfer. The organization has to have documented procedures for the transfer of design and development outputs to manufacturing. Included in this procedure, outputs need to be verified as suitable for manufacturing before becoming final production specs, and that the organization's production capability can meet the product requirements. Results, conclusions of the transfer need to be recorded. So this essentially the handoff process from design and engineering to manufacturing. (739) is control of design and development changes. The organization must determine the significance of the change to the function, performance, usability, safety, and applicable regulatory requirements for the medical device and its intended use. And the review of the design and development changes shall include evaluation of the effect of the change on constituent parts, WIP, delivered product, inputs, outputs of risk management, and the product realization process. So whenever there's a change, you need to be looking downstream. How is it going to affect the function, performance, usability, and safety of the device? How does it impact regulatory requirements, etc.? (7310) design and development files. The organization has to maintain a file for each medical device or family. The file must include or reference records generated to demonstrate conformity to the requirements for design and development, and include or reference records for design and development changes if there are any. Okay, moving into 7.4 purchasing. New criteria for the evaluation and selection of suppliers must be based on the performance of supplier and proportionate to the risk associated with the medical device. So obviously the criteria and evaluation process will be more strict based on the riskiness of the supplier and what it is that they're providing you. The organization needs to have plans to monitor and reevaluate suppliers, and this monitoring shall include their ability to meet requirements for purchased product. The results of this monitoring shall be an input to the supplier reevaluation process. So this to me suggests that all suppliers' performance needs to be monitored. The results of that monitoring need to be fed into the reevaluation process where you're making strategic decisions about the continuing suitability of your suppliers. Non-fulfillment of purchasing requirements shall be handled based on the risk associated with the purchased product in compliance with applicable regulatory requirements. Records related to the selection, monitoring, and reevaluation of suppliers must be maintained. To me, this is big, and I think organizations often struggle with this. How did you make a decision to initially select and use a supplier? That needs to be recorded. What are you monitoring them on based on what it is that they're supplying you and its risk, their overall risk? What are the monitoring results, and what are the results of the reevaluation process where you're making decisions about their continuing suitability? All three types of records must be maintained. The purchasing information must include, as applicable, a written agreement that the supplier notify the organization of changes in the purchased product prior to implementation of any changes that affect the ability of the purchased product to meet specified requirements. So yes, this may require you to change your purchasing arrangements or agreements, whatever contractual binding agreement you have with your current suppliers. (743) Verification of purchased product. When the organization becomes aware of any changes to the purchased product, the organization must determine whether these changes impact the product realization process or the medical device itself. So in the previous slide, in 742, your supplier is supposed to notify you of any changes. 743, the responsibility is now in your hands. You're expected to determine whether these changes impact the realization process or the medical device itself. (752) Cleanliness of product. The organization shall document requirements for cleanliness of product or contamination control of the product if the product cannot be cleaned prior to sterilization or its use and its cleanliness is of significance in its use. (754) Servicing activities. The organization shall analyze records of servicing activities carried out by the organization or suppliers if it outsources this process, and determine if the results of the servicing activity should be handled as a complaint, and it should be an input to the improvement process as appropriate. (756) Validation of processes for production and service provision. This is a requirement for the organization to document procedures for validation of processes. These procedures must include revalidation, criteria for revalidation, and approval of changes to processes. So if you're changing a process, how are you going to revalidate it? What are the criteria for those revalidation activities? It's also a requirement for a documented procedure for validation of computer software. This has always been there. A specific approach used must be proportionate to the associated risk and the effect of the ability of the product to conform to specifications. And records of any process or software validation activities need to be maintained. 757, we see the introduction of the concept of a sterile barrier system. Processes need to be validated prior to implementation and following product process changes. So if you're using some type of sterile barrier system, some type of packaging, for example, processes need to be validated prior to implementation and following any changes. Records need to be maintained. Referencing ISO 11607-1 and 2. 758, identification. If it's required by regulatory requirements, the organization shall document a system to assign a unique device identification to the medical device. Probably depends on what you're manufacturing. The organization also has to have a documented procedure to ensure that medical devices returned to the organization for whatever reason are identified and distinguished from conforming product. Seven, 511, preservation of product. The organization must protect product from alteration, contamination, or damage during processing, storage, handling, and distribution by designing and constructing suitable packaging and shipping containers, documenting requirements for any special conditions needed if the packaging alone is not sufficient, and if special conditions are required, they must be controlled and recorded. So you're doing periodic checks to ensure that these special conditions are being maintained. And are the results of those controls recorded? 821 tells us the organization must have a documented procedure for a feedback process that includes production and post-production activities. Any feedback gathered needs to be an input into the risk management process, as well as the product realization or improvement processes. (822) complaint handling. Brand new section here. There's a requirement for a documented procedure for the timely handling of complaints. And remember, complaints under 1345 have a very specific definition we reviewed in one of the first slides. A documented procedure for the timely handling of complaints in accordance with regulatory requirements. If you make a decision not to investigate a complaint, this needs to be recorded along with the justification for doing so. If your investigation reveals that activities outside of the organization contributed to the complaint or were part of the root cause, then your investigation needs to involve that other party. Relevant information needs to be exchanged, corrective actions need to be flowed down, and records of the entire process need to be maintained. 823, reporting to regulatory authorities. A new requirement that if applicable regulatory requirements require notification of complaints that meet specified reporting criteria of adverse events or issue advisory notices, the organization shall document procedures for providing notification to the appropriate regulatory authorities. And if you are ever reporting to a regulatory authority, records shall be maintained. So what is your process? When will you provide notification to the appropriate regulatory authorities? Again, you need to have a documented procedure here. 826, monitoring and measurement of product. Records need to identify the test equipment used to perform the measurement activities. So not only do you need to include in your records the results of the test, but what device was used, the identifier of the device. 8.3, control of non-conforming product. Again, a requirement here for a documented procedure needs to define the responsibilities and authorities for the identification, documentation, segregation, evaluation, and disposition of non-conforming product. The evaluation portion needs to include a determination of the need for an investigation and notification of any external party responsible for the nonconformity. And results of the evaluation, investigation, and rationale for any decisions or actions taken need to be maintained. So 832 and 833, we see a reorganization of some requirements just to make them easier to understand. Actions in response to non-conforming product detected before delivery are now in 832 and are separate from actions to be taken in response to non-conforming product detected after delivery. 832 tells us that non-conforming product accepted by can be accepted by concession only if justification is provided, approval is obtained, and all applicable regulatory requirements are met. And 833, in response to product that's been released to the customer, the organization shall document procedures for issuing advisory notices in accordance with applicable regulatory requirements. These procedures need to be able to be implemented at the ready, and records of the issuance of an advisory notice need to be maintained. So you need a documented procedure for issuing advisory notices. 8.4, analysis of data. The required procedure shall now include determination of appropriate methods, including statistical techniques and the extent of their use. And the analysis of data needs to include input from audits. So this may be first, second, third-party audits, audits by regulatory authorities, audits by your certification body, etc., customer audits, and servicing reports as applicable. 852 and 853, the required procedures for corrective and preventive action include a verification that the corrective preventive action taken does not adversely affect the ability of the ability to meet applicable regulatory requirements or the safety performance of the device. Okay, folks, that's all for the prepared content in today's webinar. I will now field any questions or comments that you've been typing into the question feature. We will not be sending out the presentation at the conclusion of the webinar. These will be available for download, www.pgr.com, within 24 to 48 hours at the conclusion of today's webinar. A question, do all suppliers need to sign the quality agreement? And I do believe this quality agreement comes up twice in today's presentation. So let me find that. Okay, it comes up in 742. Purchasing information must include, as applicable, a written agreement that the supplier notify the organization of changes in the purchased product prior to implementation of any changes that affect the ability of the purchased product or service. Remember, product is also a service to meet specified requirements. So yes, I cannot imagine a case where a supplier would not have to sign some type of agreement acknowledging this. The other time it comes up is earlier. I think I've missed it here. Bear with me. Relates to outsource processes. So if you make a decision to outsource a process, you need to have a written quality agreement outlining the controls that are needed for that outsourced product or service in some type of written quality agreement. So if you don't outsource a process, then you may not have to have suppliers sign agreements. They'll only be signing it for notification of changes. Bear with me, folks, as I scan through the remaining questions that are being asked and try to hit the ones that are of importance to the group. Someone's asking a question. We talked about in 826 recording the measurement device used. Our presentation doesn't say that the standard includes the words as appropriate. German, I would be hard pressed to think of a situation where as appropriate could be enacted and you would not need to record the test equipment used. Going to try and summarize this question. 1345 has the same definition of risk and risk management. How much and how deep will the new 1345 impact the operations processes of a medical device manufacturer already compliant, I believe, to 14971? The best example I can provide, Danielle, would be an organization making sure that risk analysis includes any outsourced processes. There's definitely an emphasis on outsourced processes in the new 1345. But if you're already compliant to 14971, you should be in good shape. 1345, John, doesn't specify any changes in document retention requirements. You need to be following any applicable regulatory requirements and requirements flowed down by your customers for record retention requirements. Some suppliers may not like to sign the quality agreement. What can we do for these suppliers? They have to sign it, Beverly. You need an acknowledgement in order to comply with the standard, that they notify you of changes. So there isn't a workaround for that. There's no specific requirement that a critical supplier be 1345 certified in order to be a supplier. You're expected to determine the criteria for selection, monitoring, and reevaluation of your suppliers. Certainly 1345 certification by an accredited CB makes that process easier for you. Let's face it, we all have a finite amount of resources to go around. If you have critical suppliers that aren't certified to 1345 or even 9001, you may be dedicating a lot of resources to doing on-site audits of those suppliers. The quality agreement can certainly be part of the purchase order or terms and conditions, as long as the organization is acknowledging that purchase order or terms and conditions. We'll wait a few minutes to see if any additional questions come in. A question, would I be able to get away with performing regular audits based on supplier evaluation and reevaluation? I would assume if there have been no scars, they are doing a good job. Yeah, nothing says that you necessarily have to do audits of suppliers. What the standard's asking for is criteria for selection, monitoring, and reevaluation. So you have to set what those criteria are and follow those criteria. Audits are one way to monitor suppliers, but they're not the only way. The standard's also telling you that you need to be considering the risk of what the suppliers are doing and the impact of what they're providing you, either the product or the service. Beverly, suppliers don't necessarily need to be categorized by risk, but this might be a strategic way to help you put people into categories and help determine the monitoring and evaluation methods used, but no requirement for that. A really great point here is that manufacturer responsible for the design part of the standard if the design is performed by an external party. Yes, the organization is responsible for any outsourced processes. Now, we may not audit your organization of the requirements of 7.3 because they're being provided by an external party, Karen, but we are going to be auditing you to the requirements of 7.4 and how you monitor and reevaluate that critical supplier doing the outsourced design process for you. Yeah, a lot of questions about this quality agreement. You don't necessarily have to name something quality agreement, but you need to include the fact that the organization has to notify you of changes and they have to acknowledge that somehow. And you can do that in a lot of different types of documents, terms and conditions, a purchase order, a supplier quality manual, as long as there's an acknowledgement of that by the supplier. Getting a question about computer software validation, what the critical areas are. Derek, I'm most certainly not an expert in software validation, so I can't and don't feel comfortable providing you with any guidance or additional hints on this. If you can make your question more specific, I can try to help you. Wait a few more minutes to see if any other questions come in. Okay, getting a little bit of clarification on Derek's question about software validation. An off-the-shelf software program, if that's modified, I would expect no to minimal validation of that. I wouldn't expect that that would greatly impact any medical device that incorporates that software. Any programs that you're designing or that are unique to your device are really going to be more important. Always exceptions to that. Yes, Beverly, I think any sampling plans would be risk-based. Okay, there is a requirement for documented requirements for work environment. So let's go take a look at that. Shall document the requirements for the work environment needed to achieve conformity to product requirements. Sure, there may be requirements related to contamination control or sterility, but there may also be requirements related to temperature, humidity, electrostatic discharge, lighting, etc. All those would also need to be considered, Scarlett. Again, slides and a recording of today's presentation will be available from www.pjr.com. None, I'm not understanding your question about an add-on. If you could clarify, I'll attempt to answer it in the time remaining. I would agree 642, Derek, is basically for a clean room environment. 641, work environment, is more general. Beverly, no explicit requirement for CAPAs to have a risk section. I think I know what you mean by that. But you do have to verify that both the corrective action and preventive action do not adversely affect the ability to meet the applicable regulatory requirements or safety performance requirements of the device. then on your follow-up questions, if you're changing the design by adding a non-medical component to a medical device, you would still need to meet the requirements of 739. Okay, folks, we are at our hour. I thank you for joining us today, and I wish you the best of luck in your transition. Have a great day.